Have you ever wanted to grab your doctor and give them a hard shake so they take you seriously? Obviously, you shouldn't do that, but since 2020, there's been an alarming increase in the amount of violence against doctors, including homicide, sexual assault, and other injuries. So for everybody's safety, you may be on camera the next time you're with your doctor, and here are the privacy concerns that you need to know about before your next appointment. The scope of healthcare violence is very large. Globally, 15% of doctors have experienced violence from patients or visitors, and a whopping 45% have experienced sexual harassment. The UK tallied over 20,000 cases of abuse towards healthcare staff by patients in a 5-year period. In the US, healthcare workers accounted for 73% of all non-fatal workplace injuries and illnesses due to violence in 2018. And just over 80% of nurses in the US reported at least one type of workplace violence within the past year. So it should come as no surprise that nurses in major cities may start wearing body cams, like in London. But are body cams right for patient privacy, and what about the doctor's experience? Would you want a camera pointed at you during a sensitive doctor visit, like during the physical exam portion if you're not wearing a gown? Let's not sugarcoat it. Patient privacy is a serious issue with big money behind it in the United States. Over $8 billion goes towards compliance costs and millions more in the case of privacy leaks. Body cams would throw a giant wrench in this. Like, when would you wear the camera? What if the patient is clothed or unclothed? What if it's a gynecological exam specifically? What if the patient is sharing a sensitive history of family trauma or personal trauma and it's being picked up by the microphone? Patients already have to place a tremendous load of trust in their doctors when they're sharing this sensitive information. To place that trust in a camera is something totally different. Where does that data get stored? Who will see it? How long will it be stored for? And what if someone hacks into it? These are all realities that can impact the patient-doctor relationship, which has been very strained since the pandemic, with lower and lower trust in doctors, much less their IT staff. But this whole body cam question isn't a new one. 95% of police officers in major metropolitan areas are already wearing these types of cameras. And in this fascinating study, nurses wore body cams in this high-security psychiatric hospital in the United Kingdom, with a notable reduction in antisocial and aggressive behavior. There is also evidence that body cams could reduce frivolous lawsuits. Since healthcare is already expensive and implementing body cams would be even more expensive, reducing these legal costs could potentially make the overall system more sustainable from a financial perspective. So let's say this is a go and hospitals force their doctors and nurses to wear body cams with their patients. You still have to comply with laws. Here in California, there is serious concern for how to record sensitive content, like recording of situations that may cause embarrassment or humiliation to the patient. Who decides if the content is embarrassing or humiliating? What if your nurse doesn't think something constitutes a loss of dignity and films it anyways? Would you feel comfortable signing a release form for this? And would you want to pay for all this? And then there's the question of how doctors would feel about this. Some doctors would be happy to have a deterrent to some patients bullying them or other doctors or nurses bullying them. It could also seriously help reduce the rate of he said, she said disagreements that are the source of so many frustrations for doctors in active practice. Some of us doctors would also feel more comfortable with cameras when we're sleeping in the hospital, like on call. How about sleeping with the nagging feeling that an upset patient or family member might sneak up on you any moment? This has tragically happened before, especially with female doctors in large hospitals when being on call overnight. So here are my questions for you in the audience, and please let me know what you think in the comments below. Do you feel you can trust your doctor currently in the as-is situation without cameras? Would that change knowing that you were being recorded with your doctor? And how would it depend on the situation? Do you think there should be safeguards in place for when you're having your gown taken off or talking about your mental health? Number 2, would you rather have a security officer in the room with you rather than having a body cam? Number 3, would you be afraid of that data or footage being stolen by hackers and being held for ransom? And number 4, do these body cam costs justify raising the already high prices of healthcare today? Let me know what you think in the comments below. And if you learned something new, hit that like button and subscribe to keep up with all of my medical advocacy information. And remember, you have more power over your health than you've probably ever been told.